Welcome to the Oral Systemic Connections Podcast. I'm your host, Dr. Tom Larkin, here to explore how your oral health connects to your overall well-being. From heart disease to diabetes, your mouth is the gateway to your body. Let's dive in. Welcome to the inaugural podcast, Oral Systemic Connections, where I am going to introduce you to incredible people in healthcare doing incredible things. I'm Dr. Tom Larkin. If you're a non-dental person, you will enjoy this. If you're a lay person, I promise you're going to learn something. One of my strengths when I was a professor at the university was speaking in common language that students understood. I never speak over people. And when you're in healthcare, there's a tendency to use terms and fancy terms, and you can speak over people. I'm going to take a very complicated subject today, and with the help of my friend, Dr. Craig Bax, we are going to unpack this in a way that's understandable. So without further ado, I am going to introduce you to my friend, Dr. Craig Bax, who's coming to us from Springfield, Illinois. Is that right, Craig?
That's correct.
Okay. So the first thing I want you to do is I want to go back to your pivot. Okay. You made a pivot about 12 years ago, attending the Bale-Donine preceptorship. And I want, to tell me about, you don't have to go to the backstory before that, but coming out of that preceptorship, you changed your practice of medicine and your outlook on what did you want to do. Talk to me about that process.
Well, Mark Twain said that it ain't what we don't know that gets us into trouble. It's the things that we know that just aren't so. And when I first was introduced to the concept of the Bale-Donine method and their offer a money-back guarantee if their patient has a heart attack or a stroke, I was skeptical but also curious, and I was prepared to be disappointed to think that maybe it was not all it was cracked up to be. But after drinking from a fire hose for 17 hours of information, including exposure to the dental world, which I had minimal, if any, exposure as a medical doctor, I walked away thinking to myself, there's no way that I could go back to doing what I had been doing previously. Not only, I went there in part for myself, which I think is a very common experience for many medical and dental professionals seeking solutions to our own identified health risk or actually health problems.
Yep.
I had found out that I had documented arterial disease and was seeking, what more can I do? Turns out there's a lot. So I actually, when leaving the meeting the following morning, I had my wife drive and I was sat in the back seat, and I just put together like a spreadsheet, a flow diagram of how this would actually be incorporated into my medical practice some Monday morning. I knew I wasn't going to get there that Monday morning, but nevertheless. And so for the last, it turned out that there's just, first of all, I was shocked to learn that, the inevitable progression of arterial disease to a heart attack and stroke to end up with a stent or surgery to rescue you is a model that serves the healthcare system well, but it's not a necessary medical model, and it is clearly kept. It has been largely kept from patients to know that they have a reversible progressive condition, and that early proactive intervention is helpful. Yeah. So, meeting up with, dental professionals, I started out trying to implement it the way I was taught, and then realized that it wasn't very scalable. It wasn't very affordable for most people, including myself. And so my goal was to create a process that achieved the same results, but far more accessible for everybody that was willing to make a reasonable investment in time and money, and to deliver it in a way that is user-friendly, including a telemedicine platform, looking at that even, I would say, back 6-7 years ago before COVID, and then COVID just, accelerated the need for it dramatically. And so I think we're largely there now, but I'll let your listener or your viewers decide that for themselves.
Yeah. So my story is almost identical. I went to the preceptorship the same year as a dentist. I had identifiable disease. I went because of me, right?
And I came out of there and I made a pivot. At the time I was teaching at the university, and I said, I have a little background in prevention, and I can participate in this conversation. And this thing has been a progression for me personally. Now I have a live event, which you're a faculty member in, and the thing's kind of blown up. And now the conversation is like front and center. We have a political movement now that says we need to be, prevention is going to take on a new light. Okay. And I think you and we've had that conversation online that, okay, we need to get organized with this. And that's part of my motivation for having this podcast, because I just know too many people doing really cool things. And I want to bring all this stuff together. So you have a new book, and I was honored enough to write the foreword and also a chapter on dentistry. And this is my style. Okay. You took something very complicated and you've made this in understandable language and in an understandable format. So it's Cure. It's going to be on Amazon and Kindle here in the next 3 weeks. I've sent this to some friends, and everybody's just kind of raving about it. So congratulations on that. So what I want to do today is I want to kind of walk through this book, and I want to walk through it kind of as a layperson, meaning I just think there's so many misunderstandings, and I mean basic misunderstandings, that I want to touch on. Okay. So the first thing I want to do is I want to start here with some basic anatomy. Okay. So this is an artery. Okay. And what I want people to know, the take home thing, and this will lead up to some of your ultrasound testing later. There's 3 layers. There's an inside layer, the endothelial layer, the intima layer. There is a middle layer called the media, and then there's an outer layer. The one thing I want people to understand clearly is that this is the concept of, they have a concept of arteriosclerosis, of a pipe being clogged up. And that's not, it's like a pipe in your bathroom, and that's not it, right? So the disease process that we're talking about is in the wall of the artery. That's a massively important concept that just no one seems to understand. Okay. So I'm going to have you kind of walk through this diagram and talk about this process of, so this is the progression from no disease to an actual event, and talk to me about what's happening in the wall of the artery.
Sure. Well, this actually brings everything together: the visualization, imaging, and the laboratory testing that corresponds to each stage of this condition. And I use a couple of analogies that I think are fairly familiar for most people. One is that really atherosclerosis, the term hardening or sclerosis, being calcification or hardening, is actually the latest healed stage of the disease. It's not the most dangerous. It's actually the early stage where an inflammatory process is acting on the arterial wall, much like acne works on the skin. So those of us who've had the experience of acne at one stage in our life or others know that it's an inflammatory condition of the skin. You get pimples popping up, and think of plaque as simply a pimple in the wall of your artery. And that's where all the action really is. And that's where all of our focus should be, instead of on the lumen. Dr. Balin Doneen, talk about standard arterial, vascular disease practice being luminology, focusing on the lumen, whereas what we are focusing on is arteriology, focusing on the wall.
Yes.
And so it helps to understand how it is that one can have, for many years, in many cases, a condition that's going on silently and progressing silently, and then suddenly you're feeling fine, and then 5 minutes later you're in the back of an ambulance on your way to the hospital, if you're lucky to have survived. And if you're lucky enough to get to a hot tertiary center and have a stent put in 30 minutes or 90 minutes or less, that's considered standard of care. But in fact, there are many opportunities to mitigate and reverse this process long before it gets to that point, but you have to look first. So, as I think the very end stage, what you see is that red blood clot in the lumen of the artery that didn't get there just by accident. It happened just like any other blood clot or scab, if you will. It develops in response to a wound or an injury to the wall of the artery that's precipitated by inflammation. And the stage for that event is typically set years, maybe even decades before it actually occurs. And the big reason why you and I are talking is one of the most profound and common stimuli for that inflammatory process are inflammatory conditions in the mouth,
Right.
gingivitis or periodontal disease,
Right.
and infected teeth or endodontal disease. And I may get the dental terminology wrong. Tom, you reserve the right to correct me if I muddle them up. But the key thing is to understand this is detectable, it's reversible, and you can get long-term remission. So that's why I use the word curable.
What if your role as a dental professional could go far beyond teeth? What if you weren't just treating mouths, but saving lives? Preventive dental care is evolving rapidly. The oral microbiome, salivary diagnostics, lasers, biofilm therapy, they aren't just tools, they are the future of healthcare. They're turning hygienists and dentists into leaders in disease prevention and whole body wellness. The question is, will you lead this change or be left behind? This is your moment. My name is Dr. Tom Larkin, and as a founder of Proactive Oral Wellness, my mission is simple: to equip you with the tools and processes to transform your practice and your patients' lives. That's why I'm inviting you to join me and some of the nation's leading experts in Lexington, Kentucky on April 26th for the Future of Dental Hygiene 5, The Blueprint. We will unpack the framework of the wellness-centered practice, new patient onboarding from a variety of really unique practitioners, specific preventive protocols, medical dental collaborative communication platforms, AI and prevention, and the revolutionary products that are bringing so much hope to this movement. And my podcast listeners get an exclusive offer by entering promo code POW. That stands for Proactive Oral Wellness. Every event that I've held so far has sold out over a month in advance. So reserve your spot early at oralsystemicmastery.com. Hope to see you there.
Yeah. So when we talk about the importance of the lining, okay, the endothelial, and so the conversation is inflammation. Let me put this up really quick. So this is the Bale-Donine tree. This is the root causes of inflammation. So the theory that Dr. Bale and Dr. Donine came up with was that if you can extinguish these root causes, that is what gives you the protective guarantee. If and like I said, the concept that you as a practitioner, Dr. Bale, has almost 100% track record. No one's had a heart attack or stroke. That's why I just need people to know about this method and know about practitioners who are using this method. So in the red here, I have the 3 contributors, and this is why I locked on to this immediately. When I saw this and I said, oh, I see, Dr. Bale can't practice without a dentist. He needs an evaluation of periodontal disease, endodontic disease, and obstructive sleep apnea. I was like, okay, that's the integration of medicine and dentistry that we've been waiting for. There's never been a mandatory integration. Okay, people have talked about this for a long time. This is mandatory. He can't complete his workup. You can't complete your workup. You need input from a dentist, and that's why I'm just so on fire about this. Is because people need to understand it. So those are the root causes. Extinguish the root causes, and this doesn't happen overnight. It's methodical. You take labs pretty frequently, sometimes quarterly, and you monitor this progression. And people are treated with some pharmaceuticals and some nutrients, right? So it's not complicated. It's it's a very, very straightforward process. So one of the things that I underlined was the concept that you use the term arterial injury. And I really liked that, okay? Because I hadn't heard that word before. And you're quite a wordsmith. I mean, you use terminology that makes sense. So I think about, I sprained my ankle, I blew out my knee, I hurt my back, I've got an injury that can heal. What injury does to me is it gives the capability, the capacity for healing. And I wouldn't normally I don't think we look upon an artery as having a capacity for healing. We look upon this as a process, hardening of the arteries, just managed decline. As you get older, some of us decline quicker than others, right? So you're using the words reversible, proactive intervention. And I'm like, man, this is what I want this audience to understand, okay? Because our healthcare system is broken. I'm not going to get off on a rant. I know you and I can do that all day. And this meeting that we went to, you and I went to a meeting in December, A4M, 7,000 healthcare professionals. Takeaway: the general public is fed up, and they are taking their own healthcare, thankfully, into their own hands proactively, and they're looking for proactive measures. So what I want to make sure that on the education side, that they're getting the best information, okay? And what you're doing needs to be broadcast, because number one, you have a 10-year track record. It works. I'm a patient. I'm counting on you. So let's kind of go on, and I'll ask a few more questions here on my deal. Talk to me about the word cardiometabolic disease. That's an interesting word to me.
Well, thanks. Break it down. Of course, that's the kind of the late stage manifestation that this metabolic condition ultimately causes most of the morbidity and mortality on the cardiovascular system. So heart attack, and by extension, the vascular system, stroke and peripheral vascular disease, chronic kidney disease. But it really starts with a metabolic imbalance. And I think increasingly, most of us are becoming more aware of the term insulin resistance.
Right.
I call it pre-diabetes. And our healthcare system has sort of stared at blood glucose as the be all and end all, but it's really hyperinsulinemia in response to insulin resistance. So it's like somebody driving their car with the left foot on the brake and the right foot on the accelerator and trying to keep the speed at the same level. It causes a lot of wear and tear and inflammation, fire, if you will, on that vehicle. So translate that into your body. If you have a imbalance based on insulin resistance, ingestion of glucose leads to hyperinsulinemia. That's a chronic inflammatory state that drives much of the inflammation throughout the body, but ultimately manifests most horribly, I guess I'd say, with heart attack and stroke, death and disability.
Right.
So you can't really attack arterial disease without also addressing this metabolic imbalance and the driver of insulin resistance and the resulting inflammation, which is a whole hour-long conversation in and of itself. By the time somebody has type 2 diabetes, is defined by an elevated blood glucose above a certain level or a hemoglobin A1C above a certain level. They've had pre-diabetes for a certain amount of time, but even before that, they've had pre-diabetes, insulin resistance, and that state is associated with just as much inflammation, maybe even more than the later stages of the condition. So it ultimately, all roads lead to arterial disease, and that's how people suffer and die from this chronic, progressive, but reversible medical condition.
So let's talk about the measures of arterial disease. Okay, so this is the in-body measurement, because you were talking about, visceral fat and everything, the stuff that I struggle with, and
we all do.
This is part of your, part of the measure. So talk to me about this.
Well, this is the most cost-effective member of my healthcare coaching staff. It's a bit pricey to purchase, but the impetus, the awareness, the motivation, and the progress monitoring that it provides is indispensable. We also call it the judge because it does, unfortunately, reveal some things that can hurt our feelings, but ultimately, one of the principles that underlies all of our progress and success, and by the way, I think worth mentioning that after 10 years, I should be offering a money-back guarantee and charging more because I haven't had a patient suffer a stroke or a heart attack during that period of time. But the point is that one of the concepts, whether it's our health or our finances or our athletic performance, if you measure it, it will improve. If you do not measure it, it will not improve. And so serial measurement of more than just weight, because we're made up of muscle, bone, water, and fat. And unfortunately, the scale fails to detect, I call it adiposity or fatness. I'm sorry, I did use the F word, fat in the conversation, which offends some people. I try not to offend people, but it's necessary sometimes. The point is that if you have that detail and you can follow it periodically, then you can identify the opportunities for improvement. And I use a coaching analogy. The coach tells you what's wrong with you, where you're lacking, how to improve, and then holds you accountable for that improvement by measuring the outcomes again. So with these very innovative, this technology has been around for a while. As much the alternative way of measuring body composition is DEXA scans, CT, MRI, but this uses called bioimpedance measurement. Runs an electrical current through your body, develops an electrical picture of your body, and tells you what you're made of. And it's very, it's very revealing and motivating, and in my mind, indispensable.
No, that's awesome. So that's one of the measures. Okay. So let's talk about another one. So this is you at one of my events. This is your phone. This is a butterfly probe. You have, over the course of the last 3 years, perfected a technique with your platform. One of the things that I respect so much about you is that you really do have a consciousness of access to care. Okay. Because this methodology, for the most part, is a concierge model. There are a lot of people practicing this method in a concierge model, and that's great. That's not judgmental at all. That
Right.
It is what it is. But if we really want to move the needle in healthcare, we need to have economical, concise, whatever, right? And boy, you've worked overtime. I've watched you, right? So this is the butterfly probe, and you've taken a process. This used to be a more extensive and expensive exam. So let me put this up here, okay? Because this is really the conversation, okay? What I wanted people to have the takeaway from this podcast is this concept of arteries, artery health, reversal of disease. The disease is in the wall, not in the lumen. This is really, really the crux of the biscuit, right? The 3 different types of plaque. Okay, so there's a soft plaque. This is the dangerous plaque. This is the pimple that's just full of pus ready to go. Okay, this and the reason why we have to really spend time on this is because traditional screenings can miss this. All right, if you get a calcium score when you're 40 and it's 0, that means nothing. Okay, I'm a perfect example. I had a low calcium score in my 50s, and then I started on this method, and it zoomed up, right? And so one of the things that I learned from you was that a rising calcium. Now I'm gonna repeat this twice. A rising calcium score is a measurement of healing. Can you agree with me on that?
Yes.
Right? Okay. I mean,
Well,
I'm not,
in many cases.
okay, many cases. Okay. I'm not a doctor. I don't want to get out of my lane here. Okay. You're the doctor, but I'm telling you
medical.
yeah. I'm not a medical doctor. Okay. Okay. So we have soft plaque. It's called homogeneous. We have heterogeneous, which is half and kind of a half and half. It's in the healing stage.
Right.
And then calcified plaque, and that's a plaque that is scarred and will show up on a CT scan as calcium. So that's where this whole idea of calcium scores, to me, has always been confusing. And in many instances, you tell that if somebody kind of enters the traditional system, the interventional system, and gets a calcium score, you may end up with a cath and a procedure. You could, right? And so,
I call it the slippery slope to a stent in surgery.
yeah. And so this is different. This is different. So we need to understand that plaque is in different formations in the wall, and that as it heals, it calcifies. And so having calcium present, hardening of the arteries, and that's why old-fashioned terminology doesn't really serve us. Hardening of the artery sounds like, oh, that's that progressive, bad thing, right? So an increased calcium score can be a sign of healing. Okay. Okay. Another thing I want to talk about here is CGM. So I did this on my own. I've been extremely fortunate. I'm going to talk about epigenetics. That reminds me of that in a minute. I just did this for a month, just for the grunts and grins. Okay. And I think I saw somewhere that you can do this with a watch, that they can actually have a watch. I don't know. But here's the thing. It was one of the most educational things. I think anybody that, that's halfway intelligent and uses this goes, wow, this, because if insulin resistance is the root cause of most all of this stuff, to have the knowledge of how you react to glucose individually, because we're all different, right? We all react differently. I can take something and react differently than you, but this is an individual measurement. And once again, measure, in body measure. These are measurable results. And I got to thinking about, so we're talking about the event that we have coming up, where I have a lot of thought leaders coming together, and what changes we can make in healthcare. And this was just a random thought that I had. And I thought, what if at a high school level, and I just chose high school, I don't know if that's the right time, but in high school, they have a required health class. Okay. I think they still do, whatever. And wouldn't it be just immensely productive to a 17-year-old to say, okay, class, we're all going to wear these monitors for a month. Okay. And instead of wasting dollars, money is wasted everywhere. Trust me, this would be a productive use of dollars, right? As an educational experience. And then as a young person, understand, because, kids are super tech savvy. And I see a lot of high school kids. I saw my stepson, they're going to the gym, they're taking care of themselves at a level that you and I probably didn't when we were that age. I think this would interest, there would obviously be some people not interested, but as an educational tool, don't you think a program like that would yield lifelong results?
Well, absolutely, especially if you could get their parents to do it at the same time, because the school has influence on them. But when they go home and they are fed a diet that the parents think are traditionally okay, and maybe it was when they were raised on it back then when the food was different. But one of the things I think that you bring to the forefront here is the concept of gamification.
Yeah.
If you can turn a process into a game, if you can turn it into a competition,
yes,
to be much more engaged. The person will be much more engaged. Not everybody.
That's
but,
what I was.
We don't. We're not going to engage 100% of the population, and whatever we do, it's going to be like everything else. You're going to have your explorers, your pioneers, your early adopters, and then you hit the tipping point. But we have to start somewhere.
Yeah.
But what we're trying to you're introducing here, I'm glad you did, is that these are readily available now. Now, they may not be covered by standard health insurance.
Right.
So what? The key thing, and I think we can waste decades getting the FDA to approve these things so that then Medicare, pays for it, and then the insurance plans will follow. That takes literally decades. Why not identify affordable, not necessarily, I don't like to use the word free or cheap, but affordable investments that we can make in our own health and well-being that work better than the standard approach. One of the points I would like to make is that hemoglobin A1C is used as a common, quote, screening tool. In the concept of screening, you have false positives and false negatives. And you want a screening tool that has very few false negatives. It's highly sensitive, but you accept that there are some false positives. Hemoglobin A1C misses the iceberg under the surface, the people that are pre-diabetic, that are inflamed and progressing, whereas what you're espousing here identifies this process much, much earlier, and also provides individualized, immediate feedback. Oh, I thought oatmeal was healthy. Look what it did to my blood sugar. Oh, I thought bananas were a fruit and that's good for us. Look what it does. Or maybe you get away with those things.
And I love that concept of gamification. I mean, I can see it. And so once again, let's pull back a minute, and let's say that our government going forward, who wastes hundreds of millions of dollars like it's just nothing, says we're going to do a pilot program. We're going to do this and give these things, and then get the pharma to, give them a discount and do it for free, because if you're really serious about impacting, we're on an unsustainable path. We'll do a different podcast on that, but our healthcare system is on it's bankrupting the country, and it's unsustainable. That, what you and I just talked about, could be a tool to dramatically change that. Those are the kind of thoughts that I have.
If I may just introduce, everything you're saying is absolutely true. But if you're on the receiving end of that revenue, those things are not costs, they're revenue. And so there
Right.
are numerous entities, not necessarily sinister. They may start out with good intentions, but once these things become essential to an organization or entity's revenue, they're very, very difficult to give up. And there's a lot of resistance to new and innovative ideas that threaten that revenue stream.
Yeah. Okay.
One man's cost is another man's income.
I want to touch on epigenetics because this is something that I just was ignorant on. Okay. So one of the things when I entered this process was that I knew my father had heart disease, diabetes, cancer, everything. Right. And so I'm looking at him at 50 and I'm on like man, I don't want to go down that route. Right. And so I have outlived my father's lifespan and had nothing. Right. And so I didn't understand the impact of epigenetics, and I saw that there were a couple of different lectures at A4M. So I'm just going to read something. Lifestyle choices can change the way our genes are expressed. So this is gene expression. This is kind of, I didn't know this concept. So if I'm fairly savvy. So I don't think a lot of people know this. So how the body uses information in our genes to create proteins and other molecules is called epigenetics. So maybe the lifestyle choices that I've made in the past decade, my lovely wife has certainly changed my diet for sure. It's clean. It's clean, right? Maybe I give that, I need to give that more credit because I think the number that they said was that hereditary genetics, and correct me if I'm wrong or tell me what you think the number is, but hereditary genetics was 20% and epigenetics could be 80%. Do you think it's that much?
Oh, I think that's pretty reasonable. Think of it this way: if you put, somebody who's never played poker at a table and deal them a hand of cards, how are they going to do against the experienced poker player who understands the odds and how the game is played? And that's really how I describe epigenetics. Your genetics are the cards you're dealt. The epigenetics is how you play the hand.
No, I love that. I love that. Yeah. See, this is kind of new to me. I was aware of it. But it didn't come to me as much as it came to me at the meeting. And then when I was reading your book, and like I said, your book is it's just hitting all the high spots. Okay. So,
if I could just talk briefly about one specific epigenetic phenomenon that affects almost all of us, and that is the whole insulin resistance. Why is something that is so bad for us so prevalent? And the answer is it wasn't bad for us when we were hunter-gatherers. It actually enabled the hunter-gatherer to eat one day, go several days without food, store that energy to be used later. What's changed is our environment. Our environment, our culture has turned us into grazers. And it's a mismatch between our evolved or created, however you want to look at it, genetic design, which is designed for one environment, and yet we're exposing it to another environment that's counter to its success. And that's where things go awry.
Yeah. Awesome. Okay. So there's one last thing that I want to touch on. And like I said, I'm doing like a super Cliff Notes version. I want everybody to get this book. It's straight to the point. You'll learn a lot. I want to talk about statins. Okay. If there's something, and so I confess, TikTok and, I consume some social media. And if there's something that consistently, the healthcare professionals that are on social media, if there's anything that's controversial, it's statins. Okay. This is a really super important point of the methodology that you're practicing. The risk reduction with statins is not for the reason that most think. Yes, we're concerned about LDL, but the most potent effect is the reduced inflammation in the arterial wall, that process of healing. Okay. And I don't think people understand that. And so tell me this, because this is my understanding from reading a couple of the studies. Was that kind of found out anecdotally, meaning that, the statin was initially done and then the inflammation reduction and the reduction in cardiovascular was found later? I think there were a couple of studies with rovastatin.
Yeah, I can remember. So I've been practicing for 40 years, and I think statins hit their stride in the mid 80s, which is about the time that I, started practicing. And they were new and novel. But I can remember from the beginning there was this correlation. Yes, the LDL cholesterol was impacted, but then there were these quote pleiotropic effects, meaning these effects that we don't seem to understand or can't explain.
Right.
Well, going to the Baldini method, preceptorship, and understanding that pleiotropism is about reducing inflammation.
Right.
And yet, for some reason, the system has not emphasized this. Well, I think it's largely because, we have a tendency to focus on what we can measure. So measuring cholesterol levels was easy to measure.
Makes
We
sense.
didn't have the measures early on for inflammatory conditions.
Makes
Now
sense.
we have HSC reactive protein, myeloperoxidase, LPPLA2, microalbumin creatinine ratio, and we understand that if you can induce a favorable trend in those inflammatory markers, you're reducing inflammation. And we see this all the time with statins.
Okay.
So what you're bringing up then is why now does there seem to be a war on statins, or I call it anti-statinism in the culture? And that's because they're no longer particularly profitable. I see this argument as like pharma is pushing statins because they're profitable. When you can get a year's supply of a statin for less than $20, if you use an online pharmacy, they're really dirt cheap, but the more dangerous thing is that they are preventing the progression of disease and preventing progression of the condition to the stage where the money is, and that's in the intervention and the procedures.
Right.
And then secondly, there's two other phenomena I always encourage people to say, well, I read someplace or I saw someplace, and I'd say, okay, what were they pushing as the alternative? Now, if it's lifestyle, I'm all for it. But, I call it the belt and suspenders approach. Yes, lifestyle is foundational, but let's face it, very few of us are anywhere close to perfect on lifestyle. So why not have a sprinkler system on board to protect in case things flare up? But the more, I think, important thing for us to understand is that there's expression when looking at things, the cui bono, who benefits. So what are they trying to sell you as an alternative? Is it pharma trying to sell you, instead of a $5 a month generic statin that's generally well tolerated if prescribed at lower doses for the right reason? That's the key thing with the toxicity, is lower doses.
Right.
Or are they trying to convince you can't tolerate that, so you'll take a $500 a month injection like a PCSK9 inhibitor?
Right.
And then the alternative, other side of the coin is, and this is actually probably more common, is the nutraceutical industry, which I'm much more open-minded to it than I was, say, 20 years ago. But nevertheless, there's a lot of really good stuff there. And then there's some stuff that's really just, it's a business model, let's just say.
Right.
And if they're trying to push you toward their business model, take my proprietary supplement of, herbs and spices, whatever you want to say, just be a little bit cautious and ask for, okay, what are your results? And the final thing I'll just say is that the issue is at what dose and for what reason is the statin being prescribed? Is it because you have arterial disease that we want to heal, or are we focusing or staring at LDL cholesterol? There's one interventional cardiologist in particular who's running around, poo-pooing that statins, don't prolong people's lives. Well, if we put it in the drinking water, we give it to all the 30-year-olds with elevated LDL with no arterial disease, we're going to do a lot of unnecessary treatment. But if we don't offer it and encourage it in the 70-year-old who's already had a stroke or had a stent, we're depriving them the opportunity to prevent their next event, which if your business is stents and surgery.
Right. Yeah. Well, that's what's got to change. And hopefully, there's change in the wind, and that's yet to be seen, but there's some things in motion that our healthcare system, like I said, it's not sustainable, has to change. And, these proactive interventions that you're talking about will come to the forefront. So So anyway, so that was my Cliff Notes analysis of just things that I wanted to make sure people, I hope that makes sense to you as far as like certain things where there are areas of misunderstanding. And, your book goes into the detail of the testing, supplements, medications, and inflammatory markers and stuff. And like I said, I encourage people to do that. Let me give you some contact information here. Get a hold of me, super easy, Tom at Tom Larkin, website tomlarkin.com. Dr. Bax is Dr. Bax at thecurecenter.life, and thecurecenter.life is his website. And then if you are a healthcare provider, I'm going to tell you, this is coming together to be something really, really special. April 26th here in Lexington, Kentucky, oralsystemicmastery.com has the details. And what we're going to do, in my day-to-day work, people ask me, how do I make this pivot to this wellness model? And I use the word isolates, meaning I know brilliant people doing things in isolation, and we need to be coming together as a collective to talk about. I need to know what Dr. Bax is doing in relation to dentistry, and the dentist needs to know all of it. So I'm bringing together, there's some horsepower in this room, trust me. And Dr. Bale, the founder of the Bale Don't Need Method, is one of those people that are going to be there. So I would encourage anyone, anybody in healthcare, you don't have to be a dentist or a physician, anybody, to attend this. So Craig, thank you so much for your contribution. I hope this, it was just kind of my version of how I wanted to interview and focus on the things that I had to learn because I wasn't, getting it. And so I hope to see you here in April.
Looking forward to it. Just if people are interested in downloading the book, it's available on the homepage of thecurecenter.life and that website that you
okay, curecenter.life. They'll find it right there, or on Amazon or Kindle. And
that's coming hopefully in a few weeks.
Yeah.
In the meantime, you can at least get a bit of an exposure to it.
Nice. Very good. Thank you, Craig, for your time.
Okay. Thank you so much.
And that's a wrap on today's episode of Oral Systemic Connections podcast, where we prove every week that your smile is way more powerful than you ever imagined. If you enjoyed this episode, hit that subscribe button, share it with someone who deserves to know these jaw-dropping truths, and leave us a review to help us spread the word. And remember, every smile you care for is an investment in your whole body health. Keep smiling, keep thriving, and I'll see you next time.